It's now been more than a year since the coronavirus pandemic hit, if you can believe it, sparking an intense race for vaccines, treatments, and answers. Now that a number of vaccines are rolling out, what do investors and consumers need to be aware of? Well, IBD tech reporter Allison Gatlin has a solid grip on the vaccine scene and is here to share all the details. Allison, thanks for being here today.
Absolutely. Thanks, Alyssa.
So there are a number of vaccines that are rolling out right now. Give us a lay of the land of what's going on in the vaccine front.
So we have three vaccines that are actually authorized for emergency use in the United States. We have the Pfizer BioNTech partnered vaccine. We have a vaccine from Moderna. Both of those were authorized for emergency use in December. Those are based on messenger RNA technology, which is very interesting. It actually teaches the body how to create a specific type of protein structure that will in turn prompt an immune response. We also have a vaccine authorized from Johnson & Johnson that uses a different technology, and that one's a little bit different. It actually uses one shot versus the Pfizer-BioNTech vaccine and the Moderna vaccine, which use two shots.
Okay, so we've also been hearing about these new variants coming onto the scene now. How do the new variants impact the effectiveness of these vaccines, and should people be worried about that?
There are several variants of concern that experts are interested in right now. The South Africa variant, the variant that was first discovered in South Africa, is of the most concern because it does make vaccines slightly less effective. What it does essentially is there's a mutation. It's called E484K. This mutation makes it harder for the antibodies to grab on to the virus itself, which in turn makes it more difficult for vaccines to target. The key here is that the vaccines can still work. They just might be a little bit less effective. However, when you're coming from a very high point of efficacy to begin with, the Pfizer-BioNTech vaccine in clinical testing was 95% effective. The Moderna vaccine was 94.1% effective. So when you're coming from a very high level of efficacy, it's still going to be very effective, just at a lower degree. Now, that being said, these companies weren't actually able to test their vaccines against that specific variant because it hadn't really become an issue at the point that they were running their clinical studies. Now, Johnson & Johnson and Novavax were able to test their vaccines against that variant. So their vaccines in clinical testing have shown 57% efficacy against the South Africa variant for Johnson & Johnson. And it was 60% effective for Novavax. So that's still very high efficacy, when we're talking about a variant that we still don't fully understand.
And you mentioned the one shot versus two shots. And I think a lot of everyday people out there are wanting to know if they have the choice, what's the best vaccine to get?
So you likely won't have a choice. It's going to be what your provider, what the county, what the vaccination site you attend is administering. It likely won't be up to you. That being said, all of the vaccines that we have on the market in the US and several of those that are coming up that are likely to gain authorization in the United States are very effective against death, serious illness, and hospitalizations. And that's the key point here. You might still contract COVID-19, but you likely won't die. You likely won't be admitted to the hospital.
Well, there is one vaccine that has a little bit of a controversy associated with that, and that's AstraZeneca. So can you break down what controversy is around that and maybe dispel some of the associated misinformation with that?
So there's been a lot of hiccups with the AstraZeneca vaccine. It's partnered with the University of Oxford. The vaccine ultimately proved to be 76% effective against symptomatic COVID-19 in the interim US phase 3 study. Before that, however, the Data and Safety Monitoring Board questioned whether AstraZeneca had included outdated information in its interim analysis of the study. So, AstraZeneca ran its analysis again, making sure that it used the most up-to-date data, and found that it was 76% effective, which is still very, very effective, even if that is lower than the Pfizer, BioNTech, and Moderna vaccines. There's also been a question of blood clots related to the vaccine, and that's caused a number of countries in Europe to suspend their rollout of that specific vaccine. And that's unfortunate because these claims are unsubstantiated at this point. The European Medical Agency and the World Health Organization have both said to continue using this vaccine. So at this point, that vaccine actually is not authorized for emergency use in the United States. We are still waiting for more data, but that could be coming down the line in the near term.
So taking a step back here from an investor standpoint, all of these companies that have been working on these vaccines and treatments, what does the future hold? How much longer is there going to be this intense focus on coronavirus moving forward?
I think we're going to see more headlines, more data, and more treatments, vaccines, diagnostics in the COVID-19 realm, just as long as this pandemic continues to persist. The question here is, how long will we see variants? And experts still don't know. We don't know if there is a finite number of ways that the coronavirus can mutate. And if there is a finite number, will the companies be able to come up with vaccines and treatments to target all of those variants? So right now it's really still up in the air how long we're going to see COVID-19 in the world and how long we're going to be looking at coronaviruses in general, because this COVID-19 is caused by SARS-CoV-2, the virus. That's just one form of coronavirus. There are others that can move from animals to humans, and experts are still waiting to see and understand whether this can happen again.
Well, we are definitely going to keep tabs on the vaccine rollout and how these different variants play out. And you are on top of all of this. And thanks so much for explaining everything in such an easy to understand way, Allison. I appreciate you breaking all of that down for us.
Thanks, Alyssa. Thanks for having me.
Hi there. Thanks so much for watching Investing Strategies on our YouTube channel. If you want more executive interviews and analysis of key trends to watch, make sure you hit the subscribe button so you can stay up to date.